It's an operation in your nose to basically improve the ventilation and the ability of medicine to get to your sinuses. So most of the time you're having this operation, it's because you're getting nasal congestion, pressure, or headaches, or things like polyps, which are blocking the nose and affecting the function of your nostrils. It's also important to realize that endoscopic sinus surgery happens all up your nose and there are no cuts on the outside. So the way that we do this is we use a special telescope and special small instruments which all are placed inside the nose, and we can see what's going on with our telescope, and we can try and improve that function whilst preserving all the important structures inside. Well, it's generally after we've tried medical treatment to try and reduce your symptoms as much as possible. It's important to remember that sinus surgery doesn't actually cure your problems in a number of cases. It's there to improve the ventilation of the nose and often to allow medicine to better get onto that lining to reduce your symptoms in the longer term. So we're going to be suggesting this probably after some medical treatment, and if that medical treatment hasn't been successful, then we're likely to suggest that sinus surgery might have a role. Well, it's when you tell us. If you're having problems with your nose, if you can't breathe through your nose, and we can find a potential reversible cause, then we're going to be suggesting endoscopic sinus surgery. Or equally, if there's a growth in the nose which is blocking it, endoscopic surgery might be the right thing for you. So when we think of endoscopic sinus surgery, we also have to think about what potential complications there are. And we've got to think about the things which are close by. Importantly, just to either side of your nose are your eyes. And there's a very thin wall of bone between your eye and your nose. It's called the lamina papyracea. And papyracea comes from the word papyrus, which is for paper, because it's a very thin wall. As ENT surgeons, we are experienced and we know where this is and we know how to protect it. And before operating, we will be taking a CT scan of this area to give us a sort of roadmap of the area. But about 1 in every 3,000 patients may have some damage to that wall, and that's something that we have to be honest and open with you about. Equally, just above the nose is the brain, and about 2 in every 100 patients may have a leak of the fluid called CSF from the brain downwards, and that can sometimes be repaired immediately, or if it's found out later, sometimes it's a matter of simple rest, or it will need a repair at a later date. Equally, if we're operating in the nose, there is the possibility of a nosebleed, and we're open and honest about this. So we'll be suggesting to you to not have any hot showers or really hot tea and coffee for about 2 days afterwards. But equally, we'll do lots of things inside the nose to try and reduce that risk down. Well, studies have shown it can be up to 90% effective when we consider the right patient who needs to undergo sinus surgery. So 90% of the time, if we operate on your nose, we're likely to improve your symptoms. But it's really important to remember that 1 in 8 patients may need a further operation within 5 years. As I said earlier, it's important to remember that sinus surgery isn't necessarily a cure, but it's there to try and open your sinuses so that medication can do a better job. So it's important when we think about recovery time to try and give you a vision as to how things will be. There are no cuts on the outside, so there's nothing to recover from there, but you will feel quite tired and you'll feel a bit bruised internally, and you may need a couple of days to recover. Most patients are able to go back to work within about 10 to 14 days, but it's important to remember not to be flying off anywhere, because if you're up in the plane and you were to have a nosebleed, that would be a real challenge for you. Equally, it might increase the risk of an infection. Equally, we may be suggesting to you to use sinus rinses in the nose to try and wash the nose out and help improve the healing process. You will be getting crusting up the nose, and you may get small intermittent nosebleeds and pink mucus discharge from your nose, which is normal. Equally, if we've done an operation on the septum, which is the middle bit of the nose, we might be giving you some cream to apply to the inside of your nose to help healing. It's important to think about taking painkillers, and you may be prescribed some painkillers, but equally simple painkillers like paracetamol and ibuprofen often are enough to deal with the discomfort.